what you know that they are serious on what they are doing.
Now, at least 4,000 doctors are employed in Kenya's public healthcare sector. Almost all of them went on strike on the 14th of March 2024, demanding the implementation of the labor agreement signed with the government in 2017. The agreement promised higher salaries, better working conditions, and the recruitment of doctors. Now, the Kenyan government said it didn't have the money to honor the agreement, which was signed by the previous regime. Now, to put all this into context, we are having a health crisis and now a rain crisis. I'm joined by Dr. Nora Obudo, who she's a doctor, yeah? And we're talking about professionalism. She received a bachelor's in 2005 in medicine and surgery from the University of Nairobi. In 2009, master's degrees in public health from Hebrew University, Jerusalem, Israel. She also in 2015 graduated from a Global Health Leadership Fellowship Program with the University of Washington, and she's currently the East Africa Director, Women Lift Health, and she joins us now. Thank you very much, Dr. Nora, for making time. Just for starters, we've seen what is happening with the floods. Quite sad. People losing their lives, losing their homes. Talk to us about how critical healthcare is, especially at such a time.
Thank you, Noah. I think we're in a dire state in this country. In fact, we're in a state where we call that we are in a polycrisis. As you've described, we have the climate change and the flooding that we are seeing. We are seeing hunger in Marsabit. The flooding that is affecting women and children, which we always say, even from data, that 14% women and children are likely to die as compared to men when we have such disasters. Now, how does this work with health? Because we cannot look at health no longer just as a silo. It has its intersectionalities. It has its intersectionality with the disasters we are facing, because people will be drowning, losing homes, people are hungry. All that will have a health impact one way or another. A woman who's pregnant in that flooding will need to access healthcare. How can we reach them? How can we provide the disaster management in terms of healthcare provisions? Because there needs to be continuity of healthcare, but that cannot continue. Add on the health workers strike. That means that in our public facilities, then we do not have the health workers providing services. So it leaves Kenyans in a very dire position, and this requires leadership.
Yes.
We need to have a discussion. We need to all come to the table. Without a conversation, nothing is going to happen. We're going to keep losing lives. But yet we elected leaders in positions. We expect leadership. And so we're really looking forward to this crisis being resolved by bringing everyone to the table and us having a candid discussion and really moving this agenda forward to put Kenyans first.
Definitely.
Yeah.
Talking about leadership and intentionality in the health sector, because it is a no-brainer that health is the engine if you want a productive nation.
Yes.
The way we've handled the health sector, even observing from matters policy, from matters budgeting, the way we are handling professionals in the health sector, is it something that it has long been neglected and not been intentionally taken care of? And are these sort of the fruits that we are seeing from a long-standing neglect of the sector, or is it something that is happening recently?
No, it's not recent. I think it's neglect of the sector. In essence, we have to finance the health sector appropriately. Okay. When you talk about health, it's not just the health worker. And I think this is what we really try to communicate to Kenyans at large, that it is not just the health worker, it's a whole system.
Yes. And talking about system, Dr. Sorry to cut you short. Sure. We want to go to the CBD, that is KICC. Our president is speaking. Let's hope he addresses some of these challenges. We want to cross over to IDA 2021, where President William Ruto is addressing.
With utmost humility, I extend my sincere gratitude to Your Excellencies for your active and resolute engagement. On behalf of all of us, I extend my appreciation to the President of the World Bank once again for his steadfast commitment and standing in solidarity with Africa and developing our region as we collectively champion the journey towards climate resilience and green industrialization. Ladies and gentlemen, Excellencies, I thank you.
A round of applause for His Excellency, the President of the Republic of Kenya.
All right, that is the President actually thanking the World Bank. Remember, the International Development Association is part of the World Bank, and looking at where we are as a country, macroeconomically, it's been actually a little bit difficult. That's why we've been borrowing, affecting the dollar, quite a lot going on. But there we have IDA 2021. The President has kept it very brief. But I want us to go back to our discussion. Before I interrupted Dr. You were talking about the history and where we are coming from, the way we've handled this sector. You're saying this is not a recent problem. It's been long overdue.
It's been long overdue, and it is just the perception that the health system is only the health worker. The health worker has to work through many processes that will support the delivery of services and quality and comprehensive delivery of services to the patient or to the Kenyan at large. So what I want to say is that we've not looked at ensuring that this health worker, who's human, can be able to deliver. If you're not motivated, you're not inspired, you're not being developed, you're not being given the resources to deliver a service, how will you deliver that service? And it is just a notion often that when doctors strike, it's just about the salaries. It is not about the salaries. But salaries are important because you have to earn a living. But more so, it's how are we coming together and putting all our resources together to deliver healthcare.
Okay.
Now, if we are going to, I'm seeing everything around, the salaries that, let's sort out everyone else in that health sector space and leave out the interns. Interns are they're part of the process. They work 48 hours without sleep. How can that amount, even the compensation that we're talking about providing for interns, it is not enough. We need to really appreciate the work that the doctors, interns, whether they are dentists, pharmacists, and really I'm talking across all cadres in the healthcare sector, that really need to have fair pay, need to have places that they can work, where they can thrive and it is safe, and that they can deliver what they have gone through for years, 7 years at least, in medical school, and then getting into masters for an additional 2 to 5 years for whatever specialty that they go into. But they need to be able to work.
Yes.
Yeah.
And, looking at the top story here, even the cost of training, just starting from that perspective.
Yes.
And their 2,000 medical student fee, we can talk about inflation and whatnot,
Yes.
but the fee was 38,000, which is a lot of money back then. Remember somebody trying to buy Motorola those early days with the green screen. It's quite a lot of money.
It's a lot of
but
money.
here in 2000s, 38,000. Right now, as we speak, students are paying over 600,000 a year to be trained to be doctors.
Yes.
Is it a situation of, because the government seems to be very confident and they have taken their stance, you can pay even these interns this amount, we are standing at this position, it doesn't matter. Is the confidence coming from a state of, do we have enough doctors in this country? Because I see this as one of those brain drain situation. If you can't pay me here, I'll find a way of getting value from a different market. And we've seen that happening across the continent of Africa.
Yeah. No, this is, again, something, we don't have enough doctors. The ideal WHO recommended ratio is one doctor to 1,000 population. In Kenya, it's 1 doctor to 17,000. And this is just in reference to doctors. And I have not looked at all the cadres, the ratios across all other cadres. And so if we are 1 to 17,000, how is that adequate? In fact, that doctor will be burnt out. There'll be higher degrees of error even in delivery of service. Then we are ready to say that, a doctor is greedy or they're not doing what they're supposed to do. They're trying to do, no one comes into the health working space with a desire to harm a patient or a client. Everyone comes in for the good of the client or the community. So if you're not being provided with that requires you to deliver a service, then what should we expect moving forward? So what I'm really calling for, this stance, well, we could have options. We could, decide to go outside of the country, but where is that leaving Kenya?
That's true.
Yeah, we're also not interested essentially to move our investments. There's been heavy investment from our families to even going to pay those fees. The government has invested. So if you have invested, why are you not ensuring that you have a motivated and inspired worker to deliver services? Because at the end of the day, the person who's going to suffer will be our fellow Kenyans here will suffer. Our health insurance fund is not working optimally. We are having this poly crisis that we're talking about. Who's serving in Marsabit? Who's serving in Sindo? Who's serving in Maimahiu? Where help is required.
Yeah.
And I keep wondering about this issue where we come from a point of privilege where we know we can walk into Nairobi Hospital. Not everyone has that privilege, and we should make sure that the public health facilities are providing that equity for the nation.
Definitely.
It's not the doctor's accountability point, it's really the government's accountability point. They're the duty bearers, and they must ensure that health services are accessible, they're affordable, they're comprehensive, they're of quality, and we're ensuring that the ratio is working for the Kenyans. Truly, 1 doctor to 17,000.
That's quite a concern.
And yet we do not want to employ, yet we do not want to pay, yet we do not want to look at the infrastructures in our health facilities.
I mean, an ideal world.
Yes.
I know we are far from ideal, but at least there are cases we've seen globally where systems are working. Looking at the challenge of Africa, of course, resources are really constrained with a really growing population. You've just outlined the ratio. In such an ecosystem, how do you plan yourself ideally, especially on empowering these health sector workers from a leadership point of view? Those who are seated in those positions of influence, what are they supposed to tweak to make sure at least this system starts working on a minimum?
I think we have to look at leadership. I talked about the different pillars in the health system. Leadership is one of them. I don't think we've given that much focus, and that is why as Women Lift Health, we are really focusing on the leadership component. It's not about who is leading or who's taking what position, it's how they are leading. And we keep saying that leadership is a verb, it's not a noun, it's what you do. So we want, of course, leadership that is competent. When you're competent and you add on with transformational leadership, then it's just it's a win-win situation for everyone. And transformational leadership will look at what is the constituent? Are men and women equally represented in our leadership spaces? Are they contributing to decision making? Are they bringing in their lived experiences on the table, which women tend to bring and will add value because they do not look at just individual leadership, they look at public good. What will generally, even when you look at homes, when a woman has money, she's ensuring that the home is running, the children are taken care of, the husband, the larger community. That kind of approach, that value in terms of bringing leadership in that health space is very important, because when we are saying that we are not paying these health workers, of who 70% are women, what are we doing to those homes that they're leading or managing, or communities that they're managing?
That's true.
If they're missing out on a salary, for instance, aren't we increasing the disparities, even in terms of the pay gaps that we experience for both men and women? What are we looking at?
Okay.
Yeah, so we need transformative leadership in our spaces. We need gender parity in our leadership spaces. We need sobriety in discussions. And I just believe that negotiation is additionally a skill. And so taking a hard stance often will not lead us anywhere as Kenyans. In fact, it's our fellow Kenyans going through this poly crisis, these lives that we are losing, people who are going hungry, that are suffering.
Yes, definitely.
Yeah.
So leadership is critical. I know you've insisted on the issue of gender parity,
Yes.
Which is also very important. We want to take a short break. When we come back, we touch on that issue of gender balance in the health sector.
Sure.
And the implications of that. Because economically speaking, there are implications when we involve and bring in a couple of changes,
Yes.
or a number of changes, even just trying to balance the genders. What are those changes that we potency. But right now, Business Today takes a short break. Remember, we are talking matters to do with investment in the healthcare workers. As we've seen in the recent past, that has not been the case. Different sides taking hard stands, and when we are having two elephants fighting, who suffers is the grass, and that is majority of Kenyans. We come back with more. Stay tuned.